Liver cancer is in fact one of the most common forms of cancer in the U.S. and worldwide. In fact, the most common form are metastatic deposits that spread to the liver from another site of cancer. But it's also not uncommon to have cancer originating in the liver, so-called hepatocellular carcinoma or cholangiocarcinoma. These are cancers that begin in the liver, often can be associated with cirrhosis and conditions that cause cirrhosis, such as hepatitis. When a cancer is diagnosed in the liver that originates there, often if contained in the liver, then surgical therapy is recommended. In the case where the liver function is sufficient, then often surgical removal of part of the liver, so-called liver resection, is recommended. Often this can be a difficult problem, complicated, and really requires expertise in performing these procedures, often in patients that may have cirrhosis. In addition, sometimes tumors can involve a significant portion of the liver in which major hepatectomy or major liver resection may be required. When performing surgery on the liver for liver cancer, we can take advantage of the fact that the liver can regenerate if part of the liver is removed. It can grow back, if you will. It's important, however, to assess the extent and location of the tumors within the liver in order to map out the volume of remaining liver. There are sometimes strategies we can use if the remnant volume is too small, like preoperative embolization or treatment of the part of the liver that will be removed in order to stimulate regeneration of the remaining part of the liver. It's often important, again, to have a multidisciplinary team in managing such patients, both to look at the imaging studies and determine what the best treatment plan is, but also with a multidisciplinary approach, we can often convert a patient who may be initially not surgically removable into a surgical candidate, for example, by shrinking the tumor with chemotherapy or shrinking the tumor using interarterial approaches in order to block the circulation to the tumor, shrinking it and allowing the remnant of the liver to regenerate.